Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have had 863,409 cases, 1,239 new cases reported since yesterday, 1,353 people in the hospital, and sadly, 11,288 people who have died. Even as North Carolina battles its way out of this pandemic, we know that people are still sick and sadly still dying from this disease, and our prayers are with them. But I am pleased to report that North Carolina's COVID-19 numbers have declined and remain stable. Last week, we took careful, deliberate action to ease but not lift some of the strict restrictions to move our economy forward while at the same time still protecting public health. And that means we must continue working to keep ourselves and each other safe by wearing a mask and social distancing. These simple measures are still our best tools for slowing the spread of this virus until more people are vaccinated. The State Department of Health and Human Services, our providers, continue to work extremely hard to get people vaccinated in a way that's fast and fair. Our work's getting noticed. Last week, the Kaiser Family Foundation released a report showing North Carolina as the #1 state in the nation for vaccinating people 65 and up. As of today, more than 60% of our seniors have received a vaccine. And there's more good news. The Johnson & Johnson one-shot vaccine is now authorized and will be here this week in North Carolina. It's a real advantage that this is only one shot and more easily stored. And it's been shown to be very effective in preventing hospitalization and death due to COVID-19. We expect to receive 80,000 doses beginning tomorrow. Our constant request for more vaccines has been answered. The federal government is standing up a FEMA-supported vaccination site in Greensboro to open March the 10th. It'll be open 12 hours a day, 7 days a week, and will provide up to 3,000 vaccinations a day for 8 weeks, with additional community sites and mobile vaccination clinics in Guilford and surrounding counties to reach underserved communities. Our state and local emergency management teams are hard at work getting the site ready, and we are working hard with FEMA. That's the kind of partnership we welcome and expect in this fight against the pandemic. Given the current rate of vaccinations and increased supply, many providers say they can move to the next phase of vaccinations. So I'm announcing today that all frontline essential workers in Group 3 will be eligible to receive the vaccine starting tomorrow, March the 3rd. This includes first responders and emergency personnel, such as police, firefighters, rescue workers, people who are working in manufacturing, food and agriculture, grocery stores, government workers, and our clergy, among others. Our essential frontline workers have remained on the job throughout this pandemic, and I'm grateful for their work. We're also announcing that some members of Group 4 will be eligible beginning March 24th. We'll open Group 4 first to people with medical conditions that put them at a higher risk for severe COVID-19 illness. The third vaccine and improving vaccine supply for the 2 we already are getting will help us get more people vaccinated more quickly. But as I've said before, we still don't have enough vaccine. You may have to wait for an appointment, even if today's action means that you're eligible to get vaccinated. People are eager to get vaccinated and still have to wait and plan for when it's time and their turn to get your shot. We've been able to move this quickly because of the great work of the people of North Carolina, the dedication shown by doctors, nurses, pharmacists, and others, including our DHHS staff and local health departments across the state. The patience shown by people eager to get their shot. The trusted voices who are setting good examples and encouraging and helping others. This has come together to make vaccine administration in North Carolina fast and fair. And we're pleased to see all of the educators step forward for vaccines over the past week. It's good to see more school systems getting students back in person into the classroom, as we've urged. School systems that haven't set dates to return are being pushed to get children and educators into the classroom. Learning in person is critically important to students. And I look forward this week to more action to make sure that that happens in a safe way. With declining and stabilizing COVID data, a new vaccine, a new FEMA site in our state, recent increases in total vaccine supply, and the easing of restrictions, there are many reasons to feel hopeful. However, even if when we continue to move in the right direction, we know that progress is fragile. New COVID variants are in our state, and vaccines aren't widely available yet. We all must continue to wear our masks and use good judgment. If we recommit to keeping ourselves and each other safe, we can save lives and get to the other side of this pandemic. Also with me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry, and Commissioner of Prisons, Todd Ishii. Monica McGee and Lee Williamson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. I'll now recognize Dr. Cohen for a few remarks. Dr. Cohen.
Well, thank you, Governor. This is a really exciting